All right. What we're going to do is just show you the general kind of routine to do the abdominal evaluation using some key points. Landmarks are the anterior superior iliac spines. We're going to start on the right side. We come just medial, soft hand, push down and through. We go immediately along the anterior border of the innominate. You'll find a point of restriction of movement. That point of restriction of movement typically would indicate that you found the cecum, because there are cecal folds which have a ligamentous kind of effect. Typically that's the spot right there, and then from here I'd put the hypothenar eminence of my hand over that area. That's where I would expect to find the ileocecal valve. And what I'm paying attention to with valves are a clockwise or counterclockwise type of rotation, and I'm basically trying to compare and contrast which has the more freedom of movement or which has the greater movement. This hand position will then uniformly typically drop you right on to the root of the mesentery. Root of the mesentery, depending upon the size of the individual, can be up to maybe like 9 inches or so, and it's typically in diagonal. The way you know you're on it is that if you're on it, it'll feel much like you're on a rope or a rolled up towel, and when you go to check motion on it in a parallel plane, it'll feel very significant. There'll be some resistance each motion. You can also check it perpendicular, and there'll be resistance there. If you wanted to test yourself and move somewhere where you know it isn't and check, there's a very, very distinct and different feeling. Much more ease of movement. There's not really any major restrictions. If I come right over the root of the mesentery, then I know for sure that I'm right on it. And that will run you from the ileocecal valve in the cecum area up to the end point up here, which is then the DJ junction or the duodenojejunal junction. That will feel kind of like a knuckle or a piece of a racer or a slice of an octopus tentacle or something like that. There is a muscular area. That'll be the DJ junction. And again, you find it, you can put the heel of your hand over it, hypothenar eminence. And again, what's the sense of clockwise versus counterclockwise? When you come off, when I come off, is there a sense of it twisting clockwise, or is there a sense of it twisting me counterclockwise? That's what you want to pay attention to. From there, usually about one opposite to that, with some variation for people, you'll find the second portion of the duodenum, which is in a vertical orientation typically, and in there there'll be a small little area that feels kind of like the knot that you would make when you tie a balloon, or perhaps a uncooked bean or seed or something like that, and that would represent the sphincter of Oddi. Now, when you find it, it oftentimes, especially after a meal, might be a little bit tender. Yes, a little bit tender right there. And once you've located it, again, thenar eminence on it, and feel for rotation clockwise or counterclockwise. Pay attention to that. Don't press too much on that because of the fact that you have the bile duct coming down into that area, and you have the pancreatic duct kind of merging, and they form then the ampulla of Vater and the sphincter of Oddi all in the same. It's all the same structure in the same place. You don't want to do too much stimulation of that. From there, we usually just go straight cephalad, and there should be another muscular area, again feeling like a knuckle or a big eraser or the octopus tentacle kind of idea with transverse section through there. That represents the pylorus, the pyloric antrum, and a muscular component there. From there, again, soft hand here, drag down, follow along the resistance that you get from the lesser curvature of the stomach. From there, you follow it up to the gastroesophageal junction, which will be very difficult to actually get to because it tends to be a little bit up underneath the costal margin. It typically will be inferior to and left of the xiphoid process. So what you're really kind of feeling there is kind of the area where the esophagus comes down through and then it merges into the stomach, and then there's the cardiac change and ultimately becomes the body of the stomach. So you're feeling for that muscular relationship as well, so that area. And then of course once you find it, heel of your hand typically, you need to press in, you can come up and feel, does it tend to go clockwise, counterclockwise. So a quick review, find the landmarks, hand here, slide down until I get resistance. Once I get resistance here, I come up, I find it, I feel for motion. If you're not finding or you're working with somebody who's thicker or bigger, soften this hand, use pressure down this way, and then you can motion test it. If you wish to do fascial-based treatment, you can do direct, indirect, or you can balance it. Same kind of motion as before. You can use respiratory assistance to help. That takes us up to our DJ junction. Palpate, replace, feel for rotation counterclockwise, clockwise. Follow that over to opposite side. You should be in the vicinity of it. Palpate down. Sphincter of Oddi. Again, palpate, feel. Follow it up, nice and smooth and easy. Pylorogantrum. Forward over, lesser curvature. Right in here. GE junction to the cardiac sphincter area, and palpate through there again for clockwise, counterclockwise. So all the sphincter-like areas are clockwise, counterclockwise type of rotation. The root of the mesentery is a very distinct, palpable finding that if you're on it, you should have some resistance going along it parallel. You should have some change in it going along perpendicular. Very good. That's a take. Got it. All right.